So if you are finding that you're having some challenges and maybe you've gone to different doctors, surgeons, and are considering a total knee replacement, here are some few things that I'd like you to consider. One, make sure you have your support system in place. And when I got home, I had people making me food, bringing me food. That was the biggest thing. I had no appetite in the beginning whatsoever. I did not want to eat. The pain was preventing me from wanting to do anything else but to make it stop. Food was not the drug at that point. I wanted to just make the pain stop. And sleeping was the biggest thing for me during those first couple of days. Two, if you are considering a knee replacement, make sure you understand that it's not going to be easy. However, you will see many gains the more consistent that you are. And that's what my yoga practice actually has taught me, that I can, with consistency, achieve the results that I want to achieve. Now, I've heard that people can get to 140, 45 degrees of flexion, meaning the bend in the knee. Today, in my PT session, I got to 110. So I have some ways to go, but I'm only a month out. And so I'm doing the work that I need to do, but have the support system in place. Understand that this road is not going to be a short one. It is a long one. I asked the PT the other day, I said, well, how long does this usually take? He said, 6 to 12 months. And so in my mind, I'm like, okay, I'm going to be in this for the long haul. Number three is, you need to find ways to manage the pain. If you're medication averse like I am, you have to find ways to manage the pain. This is the only way that you're going to be able to get over this hump of the initial days, initial weeks. Find ways to manage the pain. For some, that may be icing. For me, it was red light PEMF stretching, because the issue wasn't always in my knee. It actually ended up presenting itself a lot in my back. I felt like I was having constant case of sciatica. And that just came from the imbalances that were created from having the surgery to begin with. So make sure you understand that. And then four, try to make sure that you stay somewhat active. I have heard so many people tell me, you're doing too much, you're doing too much. And I laugh, because the reality is that if you don't move, you're going to actually have more challenge. I remember, again, time is scar. I didn't want that scar tissue forming. I had to move. So those would be my top four things that I would advise you to do. If you're young or young-ish like me, and this is a big decision, you have age on your side, youth on your side that you can get back. But I've also been seeing a lot of older people getting back to really good ranges. Your baseline matters. I did a lot before the surgery. I was going to PT 2 times a week. I was doing all the things that I needed to do beforehand to make sure that I was strong enough to go through the surgery and bounce back. So follow me for some more tips. I'm going to be giving some tips on the different exercises that I've been doing, on how my yoga practice is progressing, what things I'm finding more challenging to do now as opposed to before. And we'll see where we are.